Dr. Elenora Woods on your neck of the woods here in the studio live. We are ready to begin our second segment of our three with Mr. Joey Thomas, who is the Director of Community Health of CEMPA Community Care. Welcome today to our show.
Thanks for having me, Dr. Woods.
You are so welcome. Y'all, let me tell you something. They are doing something incredible here in Chattanooga, all over this city. I am just so delighted and honored that they partnered with Alton Park Development Corporation to deliver this amazing medical care to the people out here in Alton Park and this community. So, Joey, thank you for coming on. Talk to us about CEMPA. What's going on with CEMPA?
CEMPA is a community clinic here in Chattanooga. We've been here since the 1980s. We used to be called Chattanooga Cares, HIV/AIDS clinic during that time. We have grown, we've evolved, we've gotten bigger. HIV care is still the heart of what we do, but we've expanded in the past 4 or 5 years into primary care.
Wow.
Into dental. We got a dentist last year, which I know you would love, you yourself being in that field.
We're going to talk about that because we're going to do some stuff here with
We've got a walk-in clinic on Rossville Boulevard that does needle exchange. We help people with addiction kind of bridge that gap and get in with mental health. Yeah, we can go into that too. But the heart and soul of what we do is we get people health care regardless of cost of insurance, whether you're uninsured, whether you're overinsured, whether you're just somebody off the street. We believe that healthcare needs to be something that everybody can access.
That's a necessity. Now, do you all is it just for Hamilton County, or you all cover other counties outside of Hamilton County?
We cover we have patients from over 11 Southeast Tennessee counties. We do see some people from Georgia also occasionally. But we try and serve everybody from Monteagle all the way up past Athens, even south of Knoxville.
So that's a lot of counties. That is a lot of counties, because that is one of the questions that people ask. So CEMPA has I call it a medical bus. And you all travel because you all come here on the 4th Monday of every month. They are parked here on site on our property here and delivering this amazing health to the people here in Alton Park. It is an amazing thing that you do. So do you all travel to those counties when you serve them, or do you kind of put it out there? Here's where we're going to be today, and the people get to you. How does that work with people in other counties?
So our mobile clinic that is staffed with some days it's got a physician, and some days it has a physician's assistant, nurse practitioner. That is solely in the city of Chattanooga right now. Now, in other counties, for example, we do have needle exchange that'll go out to other counties, Meigs County, and they provide free HIV, Hep C testing, needle exchange, things like that, to kind of help the rural communities.
Gotcha.
Because this is since the opioid pandemic in the past 6, 7, 8 years has kind of taken off. It's really hit the rural counties.
And the DEA has really gotten really strict with us doctors. You all know that I'm a dentist in real life. They've gotten very strict with our prescriptions, how many prescriptions we write of the opioid family, how many pills people get in a certain time frame. So I know that is a major crisis, and they really manage that a lot now.
Yeah, and the state of Tennessee has laws that we fall under that regulate needle exchange. And so when we go out, we are in compliance with state law. We're working with our community partners, which do include law enforcement, local churches, to get our personnel out there for needle exchange. We provide resources. We have HIV, Hep C testing on site. And then if somebody wants to come to our main clinic in Chattanooga for follow-up, we kind of help with them and getting that coordinated, and maybe even getting them scheduled with a provider in some cases.
Yes. So we're having some technical difficulties with our monitor, but everyone can still hear us. So let us continue on. I had the opportunity to actually get on one of those mobile vehicles. It is amazing. I took some pictures, y'all. It looks just like your medical office when you go see your physician, with the bed, with all of the things that are in each treatment room. Just amazing. I was just flawed. I was like, oh my God, this is like going into my doctor's office, but I'm on a bus and it has everything there that you need. So tell us a little bit about when you're here on our site with the bus. What all can you do? I know you can do the HIV testing, and I know you can do some of the other, I guess I would say, things that don't require the physician. What type of things can you do outside of the testing that people can come over to the bus? And tell me what that looks like. They walk up to the bus, and then what?
So you're right. We designed this bus to be the same thing you would find at a medical clinic, at a hospital, at providers you've been to in the past. It's got exactly everything you think of when you think doctor, when you think clinic, when you think checkup. It's got it all.
Yes.
But when you show up, there'll be somebody sitting at a table to do check-in, and you'll kind of give your information. They'll try and ask questions, figure out what you need.
Right.
And if you want to have a visit, we will get you in that bus, and you will climb up and you'll see this little office clinic setting. We can draw blood for labs, so we can check cholesterol, we can check organ function, liver, kidneys, things like that.
Like a panel.
Yeah. We can take your blood. We'll take your weight, blood pressure, all that stuff. And then we have the provider there. So we've got all the computers, all the technology, everything is just like a medical visit that you are thinking of in your head. Yes. It is the same thing that we offer. And then we try and really meet the patient where they are, which is both literally and figuratively, because we try and match our providers with what care they need.
Yes.
So we carry a certain amount of medications on the clinic, on the mobile bus. We don't carry narcotics.
Right.
We keep that at our physical brick and mortar pharmacy on 3rd Street, but we do have medications. So if somebody's coming and they have a certain medical issue, our provider might be able to get them medication right then and right there.
Wow.
And it's usually for, I think they're running around $10 for the medication, something like that.
So I know at one time, Publix, for example, was doing free antibiotics. I think that program is ended, but it's not that expensive for certain medications like antibiotics, which is what some people need.
Yeah.
Especially can you test them for STDs on site and get the results that day? Or do they have to wait?
So in order to test for STIs, we have to have a bathroom. And currently right now, we don't have a bathroom on that mobile clinic.
Okay.
It's a headache to retrofit it and take it to somewhere and have somebody do all that work. Now that's definitely something to think about for us in the future when we roll this out, hopefully in a more lucrative fashion, more locations. But right now we're not offering drug testing. And we do have people come up and say, I'm sorry, not drug testing, STIs. We do have people come up and say, hey, I just need to get checked for an STI. And we tell them, hey, sorry, we can't do that here, but please go to our walk-in clinic or our main clinic where they can go knock that out.
Because I would think that would be something, especially in a community like ours where we serve, and it's one of the most heavily condensed, I would say, population of people with low income, that would be something that would be a great service. And we do have bathrooms here. I don't know, if that's something that we can talk about off the air, but I would like to see them be able to get tested if they want to get tested for STI, so that we can at least say, oh, you're spreading this disease, and put the contact list, who all of you. We're going to talk about that off air.
And so syphilis is on the rise. It's been on the rise this year and in at least the past 3 years. And we're talking about pediatric syphilis. So children are being born
with it,
with syphilis,
because it's been passed from the mother.
Correct. So we are all about STI testing, especially at our walk-in clinic, because we want people to get treatment, to and we call it an infection, right?
Right.
Because an infection can be treated.
That's correct.
And so, when I was a kid, it was STD.
Yeah, right. He corrected me because I said STD. Y'all know I'm old, so I'm still using an old verbiage.
I still say it too.
But it's STI for all you all that are out there. We've got educated today from Mr. Joey over here. They don't call it STDs anymore because STIs are treatable and STDs are considered not treatable. So I met your nurse practitioners when I came out to the vehicle, to the mobile clinic, and it's amazing the type of stuff that they can do.
Yeah.
If you think about it, when you go to your doctors, you're hardly ever seeing your doctors. You're seeing your nurse practitioners. Yeah. And so the fact that they have nurse practitioners, RNs on staff that are providing the service is just absolutely amazing. I am just excited about it.
Yeah. So, for this site, on the fourth Monday of every month, we have a nurse practitioner. His name is Todd Belk.
Yes.
And he's a UTC graduate. He's been with us for quite a while, and he is the one serving this community, and you couldn't have a better provider out there. In order to work at CEMPA, you got to really want to make a dent in the health disparities.
Yes.
So it's not like we're just getting random providers, random nurse practitioners to come here.
Right.
These are people who chose to work at a clinic like CEMPA to treat people who are affected by health disparities. So
That's
he
awesome.
wants to be here. Everybody on that clinic wants to be here. They want to get healthcare to people.
Well, I'm telling you what, this couldn't have been a better partnership with CEMPA because Alton Park Development Corporation's property sits right dead in the middle of the most highly, I call it condensed or populated people that have the least amount of money. Access to care is horrible, and they have the most poverty, and the health issues in these communities are just exasperating. I mean, so it is probably the best place to be right now in terms of Chattanooga is in a condition or a community like Alton Park and in the surrounding areas of Alton Park where we're located. It's just perfect. I am excited. I want to see you all come and use this facility because it's now in your neck of the woods. I like to use that word. It's in your neck of the woods. So we want you to come out on the fourth Monday of every month and get yourself checked out. If nothing else, let them check your heart out. Let them check to make sure your blood glucose levels are right, that your blood pressure is right. It's just a whole lot of things that go misdiagnosed. I see it every day in my office. Someone comes in for an extraction, just to have a simple extraction, and we find out they've got hypertension. We find out they've got diabetes. We're doing these little quick tests, and then we have to refer them to the doctors to get adequately diagnosed and treated for it. But this is where you can actually come, get yourself checked out, and get some help before it's too late.
Yeah, and the whole point of us doing the mobile clinic was transportation is an issue.
Yes.
And it's not only with CEMPA. I'm sure Erlanger, Memorial Park Ridge, other clinics, I'm sure they're dealing with the same thing. So the idea was if it's a burden to get transportation to your medical provider, we're going to remove that burden and we're just going to come to you. Yes. And as you said, this zip code gets ignored, overlooked.
Yes, it does.
Pushed to the side. And so we intentionally came here to remove that barrier to get people care.
And we want them to feel okay with coming on the bus and getting checked. Some people are afraid. They look at the facility like this is the federal government. They're going to get in trouble. So they're afraid to come in and maybe, I don't know, some circumstance they have. It may trigger in their mind that if I go on and they get my information, then I'm going to get found out that I'm doing X, Y, Z. So what can you say to those people who are afraid to come on because they look at you as a federal agency, so to speak?
So we are what's called a federally qualified health center. And that just means that our focus is on patients who tend to get pushed to the side, ignored, the health disparities. That is our focus. And so when people feel afraid about coming to us, we started, as I said, in the 80s as an HIV/AIDS clinic. We were treating people at that time who
Nobody else wanted to see him.
Nobody wanted to see him. Nobody wanted to talk to him. Nobody wanted to be in the same room as them.
Yes.
And so we had to work, and I say we collectively because I wasn't there, but we had to work to build that trust.
That's right.
To say, please come see us, remove those barriers. And today we treat a lot of people who have been incarcerated. We treat a lot of people who have addiction, drug abuse, alcohol abuse. We treat a lot of people with mental health. So if you're worried about being judged or being stigmatized, CEMPA is not the place to worry about that.
Right.
That is what we want to see. We want to see those people who feel like they're going to be judged, who feel like the provider won't understand, because we have, so for example, our chief medical officer has been with us for years. He's seen it all.
Yes.
You're not going to surprise a CEMPA provider.
Right.
You're not going to tell them something that they haven't heard.
That's right. My patients come in and say all the time, I know my mouth is the worst mouth you've ever seen. After I've done this now for 33 years, baby, I've seen everything. Trust me. I've seen it all.
We've treated the homeless. We've had a provider in the past who on Fridays would load up a bag and go to the homeless camps and provide care for free on during his free time. It would be his off time. And he
give him back.
We've seen it all. Yeah. So if you think that whatever issue you're dealing with is unique or is something that's going to cause the provider to stigmatize you or judge you, then CEMPA is not the place.
It's judge-free zone when you deal with CEMPA. Now, my sorority, and I've talked to you before, we're interested in also partnering to do, because a lot of times these athletes have to get their exams prior to being admitted onto an athletic team. So for those type of people, we're going to talk about it off the air, but we want to be able to get them their physicals to clear them to play sports. We want to partner with you for that, because in this area, we got the Howard High School. We got all these programs, around Alton Park, St. Elmo schools. I mean, these kids have to have those physicals done, and we want to work with you all to make that happen.
Yeah. And we do too. But, and this is a big but, is we don't treat children.
Oh, no children. So what age you have to be? 18?
Yeah, we treat adults, and that's because that we don't have the certifications and licensure to do pediatric, right? But we partner with LifeSpring pediatricians.
Okay.
They're actually on our same block on 3rd Street.
Okay.
And part of the beauty of the mobile clinic is that we could really, in the future, develop it to whatever we need.
Yes.
So it might be like what you're saying is we could roll out that mobile clinic to all these schools while they're getting ready for football or whatnot, and bring a pediatrician with us.
Work on that. We're going to work on getting that pediatrician.
And we connect that pediatrician to these kids.
There you go.
And they do it on our clinic and our mobile unit, and everybody walks away with a smile and gets what they need.
Joey, now we think, what did we just come up with that right on?
I think we did
on WPTP. We just solved another issue, y'all.
I think we just solved the world's problem.
We just solved it right here for CEMPA. So, what else do you want the audience to know? Because you all do so much. What else do you want them to know? I see immunizations and vaccinations.
Yeah.
Now, is that adults only for immunization and vaccination? Adults only. Okay. So we're dealing with
here's a big thing that your audience needs to know. We have what's called a sliding fee scale. And so what you pay is based on what you make.
Okay. So do they need to bring proof of income?
They will need to bring proof of income if they want to go that route.
Okay.
Now, you don't have to do it, right?
Right.
But we offer the sliding fee scale.
Okay.
And so if you're making X amount of dollars, your visit might be $20.
Right. Well, you've got Medicaid, some adults have Medicaid. Some of those plans may cover all of it.
Yeah. Yeah. And you could have a free visit.
There you go.
But in order to do that, you do need a proof of income. Now, what is a proof of income? It could be a paycheck stub. It could just be a handwritten letter from your boss saying,
this is what you make.
This is what you make. I pay Billy Bob $20 a day.
Or your tax return, or if you get a check every month, your disability check or your Social Security check stub, You can bring a letter from the Social Security Administration.
It could be it could be a handwritten letter from whoever pays you.
Okay, I got it.
As long as you get a proof of income.
And if you don't work anywhere, you don't get any benefits. Now what?
Still come see us.
Okay.
We have programs that if you fit, we can get you enrolled in to where you get free care. We have the sliding fee scale sometimes. And this isn't for everybody, but sometimes we just give uncompensated free care.
That's what I'm
talking about. Because that's the way the world works. And sometimes somebody just needs care.
That needs care.
Because we do see people who are coming from incarceration who might not have a job. But for example, they've got hepatitis C.
And they need to be helped.
And hepatitis C, if you don't know, it's a disease that usually a lot of times travels through needle use. And so with the opioid epidemic, we've seen a lot of hepatitis C.
Yes.
So there are some people with their hepatitis C and they don't have $1 to their name. We might be able to figure something out because hepatitis C is curable.
Yes.
And if you don't do anything, it could lead to liver failure. It could lead to death.
Wow.
So we try and get people the care they need, especially with HIV. Biden administration, Obama administration, even I think the Trump administration has been trying to lower the rates of HIV in America. And as part of that, I
think that number has went down, has it not? What is the trend showing now? Is it shifted over to another disease? Usually when one disease goes down, you'll see another one that's been silent for a while kind of creep up.
That's syphilis.
Syphilis.
So we have made such strides in HIV prevention that people think, oh, HIV doesn't exist anymore the way it did back then.
And the medicine that they've come out with now
is so much better. But we've seen a rise in STIs because people, the younger generation, their behavior. And we really need to push people to remember that just because there's been advancements in HIV medicine, thanks to people like Magic Johnson, the news and attention that he brought to that,
right?
Thanks to hard work of scientists, medical doctors, and people with HIV who've been part of the research. We've made lots of advancements, but now that's caused people
to get careless.
Hey, we can get careless. They can cure everything.
Yeah,
we
can't cure all the medicine.
We can't cure everything. That's silly, but syphilis is on the rise. So we really need people to be responsible, regardless of what you think is happening in the medical world.
Yes. So, wow, Joey, I'm telling you, I'm just really overwhelmed and feel so much joy for what you all are doing in this community. So if you live out in Alton Park, y'all, the services are here for you. And they got a mobile clinic every 4th Monday from 9 o'clock in the morning to 3 o'clock. You can just roll up on them and get all this good health care. Bring some of your information, your identification. If you have proof of income, bring that with you, and let them go ahead and take care of you. We're going to work on getting the testing done, because that is a real big critical need in our community, is making sure that if people have a STI, that they get not only tested for if they think they have it, because there's some symptoms, and then get treated for it.
Yeah.
And so we want to make that accessible and available too, so that doesn't get out of control.
Yeah. And you reminded me, there's no appointment required. There's no, like we said, there's no insurance required. You can just walk up. Now, if you don't have anything, you didn't bring proof of income, anything, you don't have any money, you don't have any insurance, that first visit is likely to be free.
Yes.
Now,
but we need to know who you are. So bring some type
we need to know who you are,
because you track
right?
people, right, based on their location. It's important to track individuals. Well, not necessarily, because some people may walk up to your mobile and don't live out in Alton Park. They come from another community.
We've had people come to our clinic who don't live in Chattanooga, who don't live in East Tennessee, North Georgia, North Alabama. They just happen to be visiting, and they need healthcare, and they come in. And when we prescribe medicine, when we have patients, we just like to know who they are. Right. So if they show up again, we can say, oh yeah, this is Dr. Woods. We saw her 6 months ago because she had a cold.
Right.
And so then we're like, how have you been since your cold?
Yeah.
And then you tell, well, a couple other things happened. And then, that's what your provider does. They care for you, not just in that moment of time, but for your extended adulthood period, lifetime. So they want to know about you. They want to see changes, especially if you get blood drawn or you have your blood pressure done, because they want to see how your organs are doing, how your cholesterol is doing, how your blood pressure is doing. Because if those numbers start to go the wrong way,
right,
then
we have saved so many people lives because people don't know.
Yeah.
And I'm gonna kind of sum it up. People don't know that they're not healthy until they get tested, until somebody takes that blood pressure, pulls that blood, and they see, oh my God, I've got diabetes, because they don't go to the doctor for whatever reason. But when they have to go to the doctor, this is when they usually find out.
And we don't want that. We want you to come before.
We want you to come before. And we have saved so many people out. I have had to turn patients away from getting dental care, because their blood pressure was so high that I couldn't even give them anesthesia to begin with. They could have a accident right in my chair. So we sent them straight to the emergency room, or even call the ambulance to take them, because it's so high that they don't even need to be driving.
And that's why hypertension is called the silent killer.
It's a silent killer.
And it'll affect your kidneys without you knowing it.
Yes.
And so the next thing you know, you're having pain in your kidneys or your lower back, which can also confuse some people, because they'll have a pain in their lower back.
And it's all related to the heart.
And it's related to their kidneys, heart, blood pressure. Next thing they know, like you said, their blood pressure is out of control.
But correct.
That blood pressure needs to be monitored. And it's something you can do at home. It's something if it is high, you can get with a provider. We have a nutritionist. I don't think I mentioned that.
Nutritionist.
Sorry. I'm sorry. She's going to get upset at me. She is a registered dietitian. She went to school for a very long time. She's very good at what she does.
Yes.
But she sits down with patients who want to, and she talks about getting your blood pressure under control. It's a lot of blood pressure is lifestyle. A lot of blood pressure is your lifestyle. Smoking, drinking. If you eat a certain food every day that's not good for you, it's going to add up. Yeah.
And that sedentary lifestyle, we all can work on that, getting a little bit more active, to keep the blood flowing and the oxygen in our cells, to keep it pumping. And so that's the kind of stuff nutritionists talk to you about: proper eating and the things that you can do to balance your lifestyle that you have with exercise, eating properly, all eating and sleeping properly.
Oh, sleeping's big too.
It's really big. So, and I've been working on that. I know you all have noticed how cute I'm getting. I'm going to brag on myself a little bit, because I have been really working on health. And it was a nutritionist that sat down with me. She's been on this show, that sat down with me and showed me the things that I could do daily with changing the lifestyle. And it doesn't happen overnight. These things, you've been doing the wrong thing for 10 or 15, 20 years, maybe all your life. And you have to undo that. And it takes a minute to let your body reset. So it's a lifestyle change. It's not just an overnight change. It's a lifestyle change. And so I believe in nutritionists. I believe in what they do. And I thank them for what they do, because they are really saving people's lives as well.
And if you don't have a nutritionist, dietitian, but you're probably considering it, and you want to come see our mobile clinic, they can talk to you about how that works. Because once you become one of our patients with our sliding fee scale, then that option becomes open to you. Another thing we got to talk about is our pharmacy. We're what's called a 340B pharmacy, which means that we get prescription medications at a discount rate. And that discount usually filters down to the patient.
Yes.
So a lot of the word on the street is you'll hear that CEMPA has lower prices for prescriptions, and that's why. It's our 340B program pharmacy. Our pharmacists and our pharmacy staff do a great job of getting the lowest price for our patients.
And I'm going to kind of sum it up on this. The worst thing to do is to tell somebody that they have this medical condition and write them a prescription that they can't fill. So, and it's usually, in most 9 out of 10, it's a financial issue. So wherever we can save money to help our patients get the medication that they need, that is a plus. And so we want to make sure that people know that when they come to CEMPA, that program is designed for people with low income. And so that's the other benefit of using the CEMPA healthcare facility to manage your health issues, because the medicine that you need will come at
and
a bargain.
the 340B, if I remember correctly, it was started to help veterans with their costs for prescriptions.
Okay.
And so it's kind of expanded into modern day to where we try and help. You don't have to be a veteran. You can just be somebody who utilizes, in this case, a CEMPA provider to get your prescription, so that we can reduce those costs, especially as you get older with Medicare. You mentioned Medicaid, TennCare.
Yes.
Prescriptions can add up, especially if they're needed for an extended period of time.
Wow. Well, Joey, I'm telling you, I think we have really educated this community about your services. And how can they reach you? Is there a website or a number if they wanted to call? Do we have that? We can flash across the screen. Let's get that. So, CEMPA.org is their website.
Mm-hmm.
And I don't see the phone number up there. Do you have a way?
It's hidden up there. It's 423-265-2273.
Okay. All right. So there, you can scan that with your phone, and it'll lead you straight to all that information. Yeah. And you can always reach back out to Alton Park Development Corporation, because we are partners with CEMPA, and we want to see you be healthy. And that's another thing that Alton Park Development Corporation is noted for, is community health.
Mm-hmm.
And so we are here today to let you know that we brought it to you. If you can't get to them, we brought it to you. And we're here for that purpose, to make sure you can get the health care that you need. And we thank you so much for dropping by.
Yeah, thanks for the invite.
Yes, keep up the good work. And you all know I told you that we have 3 segments today. So don't touch that dial. Don't you all move. If you do move, go use the restroom, get your little bite, come right back to the screen, because next we have the Honorable State Representative Yusuf Hakeem. He's in the house. He's been ready, and he's loaded, you all. And I'm excited to have him on the show today. And I know he's probably done some great things for CEMPA in the legislation to make some things roll much faster.
There are honestly some good Tennessee laws that really help.
Yes, and he helped establish that and sign off on those bills.
Yeah.
And so we are excited to have him. We're going to change the scene, and we will be right back with you. And I just want to thank Mr. Joey Thomas again for coming on What's Happening in Your Neck of the Woods on WPTP 100.1 FM radio in the heart of downtown Chattanooga and Alton Park, Chattanooga, Tennessee. And we'll see you in just a moment. All right, welcome back to WPTP 100.1 FM radio on what's happening in your neck of the woods. I'm your talk show host, Dr. Elenora Woods, and today, yes, we have the Honorable State Representative for District 28, Mr. Yusuf Hakeem in the house. Hello, hello.
Hello, and thank you for having me.
Oh, I'm telling you, I feel real good today. We have our honorable state representative in the house, and you all know when he stopped by, he got something good to say, and he got something important to say, and he has some good news for us because he represents District 28, which is where Alton Park Development Corporation is housed in his district. So we're always excited to have him on the air to give us some updates on what's been going on and to educate you on some things that are coming up. So welcome, State Representative Yusuf Hakeem.
Thank you, ma'am.
Yeah. So tell me, now we know there's a lot of stuff going on, but tell us, what have you been doing these last, finishing your third year of your second term,
Yes,
right?
yes.
Yes. And tell us, what have you done? Because we want to know, the people want to know, what have you done? Because you know, I'll be like, I don't know what he's done. I don't know what he's done. That's because they're not tuned in. You know what I'm saying? Tell us what you have really been doing and how it has benefited your district.
Okay. Well, thank you again for having me. And I think we have to realize that in the state legislature, you have to build relationships to get anything done.
Yes.
Because it takes 50 votes to move some legislation forward or to get some appropriations. Now, some of the things we've done as far as appropriations are concerned is to acquire $10.2 million for the Booker T. Washington State Park.
Yay!
Yeah. Massive improvements that, we'll be making there over the next year or so. And I think we're all looking forward to that. In addition to that, the Chattanooga Zoo, we were responsible for the zoo receiving $1 million.
Oh, bless the animals.
And the Bessie Smith Cultural Center received $250,000 from the state, but there was a open grant process that was open this year, and they received yesterday another $62,000 from the state.
Congratulations to the Betsy. Yes, beautiful museum.
Yeah, and those are some of the things that we've done, but to look at what we're doing out here at this institution and for the community, we're trying to get that necessary paperwork together so that we can do what is needed in this part of town. There's a lot of needs, not only here, but throughout our district, but we're going to continue to work in that area. And some of the things we've been working on is healthcare, in particular, women's healthcare.
Yes, I think I just read, and I understand that you just passed a real big, important bill that deal with women's health. So I want to, they've been working hard up there because they were fighting about that. And so we got that done. I think the governor just signed that.
Well,
tell me a little bit about that bill.
Okay. That has been and is a fight between what are called progressives and conservatives. And in reality, we have been fighting with our colleagues who don't want to make the minimum amount of changes in the healthcare policy when it comes to women's health in the state of Tennessee. What I'm saying is we have a policy in regards to pregnancy.
Yes.
That, basically, if your doctor treats you and at the end of the day, it requires what do we call it? An abortion.
Yes.
Then that doctor has to prove that what they did was necessary. It's a reverse of what we have in government in general. The government normally has to prove that you are did something that was not inappropriate. And in addition to that, some of the things that I fought for in committee was to have exceptions for rape, particularly children, incest, and so forth. And let's just say I raised my voice and I think I was heard, but at the same time, they had the votes. to keep those exceptions from being accepted.
We're going to talk about them votes because I think people don't understand. And I mean, this is not a political class 101 or anything, but we need to understand the state of Tennessee. This is a Republican state. And what I mean by that is it takes 50 votes to pass any piece of legislation.
Yes.
And there are only 24 Democrats in the House of Representatives, and the other 76, or is it 70, 75, are Republicans. It's total 99. And so if they need to pass a piece of legislation in case folks are running and they're on the Democratic ticket and they think that they're just going to run up in there and just raise their hand and they're going to get something passed, you better make some friends with those 75 folks that sit over on the left or the right side, because you only got 24, you need 50. So that means you're going to need an additional 26 votes. And it's not coming from the Democrats, it's got to come from the Republicans. So you have to be able to reach across the aisle, make friends. And sometime when you first go up there, I'm going to defend him a little bit, because when he first went up there as a freshman, he didn't really have no friends. He had to make some friends. And how do you make friends? It takes a little bit of giving in order to be able to take. You understand what I'm saying? So people have the wrong idea about how they think they can make things happen. I think the president of the United States understands that very well. So much you want to do, but you don't have the affection from the other side. And even if they do like you, you know, if it's their principles is against what you're trying to do, they're not going to give you the votes. So it's not that easy.
That's true.
It's really not that easy. And I think I was kind of mad at Yusuf Hakeem too, the freshman year, but I had to think about it. He's a freshman. You know, you remember when you went to college, if any of y'all went to college, or just say high school. Remember when you were a freshman in high school and you had the sophomores, the juniors, and the seniors? Well, that's kind of how it is in politics. When you come in as a freshman, you have no power. And you got to move yourself up to become a sophomore, and then move yourself up to become a junior, and then you're a senior. It takes years to build relationship to where you have some power. And the power don't necessarily come from you raising your voice as much as it does raising them votes.
And it does take listening to other people to understand their view and their perspective. But we have been able to do some things that some people felt were impossible in the legislature. As an example, we have a Black History bill where Black history would be in our the books for students going forward in the high school.
Because they took that out. You all remember that? Was that you clowning about that Black history up there?
Oh, we had to.
Okay, that's what I'm talking about. Don't throw away Black history now. You get underneath my skin on that one.
And so as a result of that, working with people on both sides of the aisle, in 2025, we in our civics and history textbooks, there should be ample amount of information in regards to African Americans and their contributions to making this nation as great as it is.
And that really concerned me when they took all the ability from institutions to teach African history from I guess the syllabus. It's a part of the curriculum of the courses, because that to me was saying, you know, we want you to silence that part of history and just only learn this part, which in turn it kind of takes away something on the inside of you as a person. How can I know and feel good about being Black if I'm not being taught Black history?
Well, I think that was the intent, to limit how you feel about yourself and feel about others. And I thought that I was really a history buff, but even today I find things about our history, our heritage, that I didn't know as I was growing up. But I was also taught to feel good about myself, to work with people on all walks of life. And as a result of that, I think I've been able to get a few things done, not only in the legislature, but on school board, but city council also.
And I want to really, tip my hat to our state representative, because The Alton Park Development Corporation, as you all know, will be doing a ribbon cutting ceremony, a grand opening of the African American Education and Heritage Museum here at this site. And he will be there to help us celebrate that moment. And I know a lot of people say, well, we already got a Black museum, a Black History Museum. I said, it's not the same.
Okay.
It is not the same. And I want to applaud Betsy, because Betsy is an amazing museum. If you have not been to the Betsy Museum, you have to go. I love it. Every time I go, I learn something new that I did not know. And it's beautiful. It's beautiful. It's well put together. And it's something that I believe, if you're going to have a museum, if you're going to represent Black in the museum, it needs to be done with such perfection.
Yes.
And so they have perfected the art, and I'm proud of them for what they're doing. And we're going to invite them to come to our grand opening, all of them, because we are in this together. And as you all saw earlier on our show earlier, Mr. Harold Bryson, who has taught Black history for more than 5 decades, is a part of our Heritage Education and Heritage Museum, and that he'll be teaching Black history, African history, as he says, and African American history. They're 2 different things, but he's going to talk about it from the cradle all the way to today. And we're very excited about that. So you can get all the education you want to know from those courses that he's going to be offering. He'll be here on June the 22nd. Don't y'all miss June the 22nd, because that is going to be a celebration. It's our Juneteenth celebration. It's our grand opening for our museum. It's also our rollout on our African American history courses that we'll be offering here at this facility. And you have a chance to sign up. You get a chance to do a sneak preview of the museum. It's going on right now. They are working in that museum to get ready for that soft opening. And we also want to throw it out there for those that have African paintings or parts of history that all the way from slavery all the way up to today, and you want to put it on loaner, we can put it on loaner in our museum so that people that come through can learn even more, and we can share even more. We have tons of things that have been donated, and we really just don't even know where all this stuff gonna go. I know that's where you have a problem there at the Betsy, is putting it on exhibit and making room for new exhibits when they come. But we're going to do our best to complement what Bessie Smith is doing and offer the educational piece.
Yes.
The educational piece that's missing in our community through the African American Education and Heritage Museum. And we'll be working with Mr. Hakeem in the legislation, as we get things done moving forward. We're going to be working with him. I'm just saying that. I'm putting that out there because he is our state representative. He is our state representative. He has been for the past, is it 8 years?
6 years.
6 years. He's done a fantastic job. And I want to applaud him. For those who are listening, he has done an excellent job. And there's still more to do. But he has been making friends. I know he has. He's had to move from a freshman to a sophomore to now you're going to move on into that junior, right? And he's going to be able to get even more because they like you.
Okay.
They like you. The Republicans like him and the Democrats love him. I'm going to say it like that. The Republicans like him and some of the Republicans love you too. So I'm not going to put it out there like that. But I'm just saying you've done a fantastic job.
Well, thank you.
And we are very proud to have you as our representative. And the things that you've done, I know you want to even do more.
Yes.
But people need to understand the barriers that exist on the Hill in Nashville. You need to understand the barriers, and you can't bully your way.
All right.
You cannot bully your way into nothing. You have to work your way into it.
Yes.
Those that are used to politics and understand how politics go. And I've been in doing politics for 33 years. And I can tell you, it is a Republican-ran, white male organization.
Okay.
But guess what? I love them.
Okay.
And they love me. And the reason why that's true is because I never bullied my way. I just explained my way.
Okay.
If you explain your way, you can get things done. And you have done a wonderful job of explaining yourself. and getting things done. And now they want to help you even more.
Yes. Okay.
Now they want to help you even more. So tell us what your plans are. What do you plan to do when you go back as our state representative?
Well, some of the things that we're working on is in regards to the voucher bill. Some people assume because it was stopped this year that it won't be back. The governor's made it clear that he wants to bring that back. And that's where it comes in.
When you say voucher, what vouchers are you talking about?
Okay.
Tell us what vouchers you're talking about.
These are school vouchers where you take public money and give it to private institutions for people to send their children to. Now, this is something that particularly the rural communities have concerns about because they don't have a lot of private schools and things of that nature, that kind of choice. So if you're taking money away from them, you're lessening the ability of children in those areas to be educated. And we think about the inner city. We know that schools are not funded properly now. Teachers are not getting the kind of salaries they need now. But you're going to open up this door where you're going to take public dollars and give it to private entities. I think that is wrong. And they want to use, the governor wants to use the term providing a citizen's choice. But now we pay taxes too.
Absolutely.
And as a result of this, we're saying, don't take money away from what we're doing in our public schools. And I think we're both examples of what can happen in a public school.
Absolutely.
Being successful. So we have to be mindful of that and not let them take away what public schools have done and are doing for our communities.
And I want to pick you on that because, you know, I was brought up in a public school, had a great education.
Okay.
And my children were brought up in private school. Now, private school was a choice.
Okay.
And because it was a choice, I paid for it. It didn't come out of nobody's taxpayers' money. It came out of my pocketbook, and I had to make the sacrifice. If I wanted my child to go to a private school, and this is not to talk about private schools in a negative way, I'm just telling you that that is a choice. What we should be focusing on is what's wrong with the public schools, and let's fix that.
Yes, yes.
Because running away from a problem doesn't solve a problem. If it's a problem, if you feel that your child is not getting a good education, we need to talk about that. That's what your school board representatives are for. The principals, you know, the administrators that run the public schools, that's what they're there for. And still, even when you go to private school, guess what? You're gonna have to do some things at home.
Okay.
You see, education starts at home. It don't start when they hit the door at the school. I can tell you that. Because you can go to a private school and still get miseducated.
Okay.
You understand what I'm saying? I'm talking about you paying $20,000 and $30,000 a year per child to go to private school, and they walk into the school and they're not paying attention. You know, they're not doing their homework. The parents at home are not helping their kids, or maybe they can't afford these tutors that you got to pay for, and the kid still gets miseducated and left behind. So it's not the school that's the problem. It starts at home.
Yes.
It really starts at home. So let's just erase that because you can get a good education in public school. I'm an example of it. I started at James A. Henry Elementary School in the West Side Project. And went on to Normal Park when they started busing because Normal Park is on the north side of the river. So the kids on the west side of the river end up swapping out with the kids on the north side of the river. And I ended up going to Normal Park and then north side and then completed that city. Public schools. My kids, the Bright School, GPS, you know, Center School. So I'm telling you, it doesn't matter. I'm the doctor. You see what I'm saying? I'm the doctor in the family that went to public school. And my kids are not doctors, but they could be. But they're not. That's not what they choose to do. So what I'm trying to tell you is don't blame it on the fact that the kids are not getting educated in school. This got to start at home. Let's put that money in public school and keep and make them accountable. Pay them teachers what they need to get paid. Get that money. That's what he does. at the legislative level is make those bills to change and get that money in the budget so the teachers can get better pay. I think they need better pay. They're putting up with a lot more than the teachers during my era had to put up with, because the homes are broken more today than they were back then.
Yeah. And, you know, if people in government, you know, like the governor, would think about it, if you remove, we'll say, that young person who has that ability to thrive in either location, public or private, and you just leave young people who don't have what they need at home when it comes to helping with their growth and development academically, what are you doing? You're building an underclass of people who are angry at the fact that my next door neighbor is going to a private school, and here I am in a school with people who don't want to advance, or not enough people who want to advance.
Right.
And what do? They may get into something that takes the life of another person.
That's it.
Or, you know, robbing people, things of that nature. So it's, in my view, to the benefit of our society as a whole, if we have that mixture of young people, so that those who may have difficulty learning can feel they need that need to grow and develop and be the best they can. And, you know, another thing about the education piece is that in private schools, there's not the same teacher requirements that you have in public schools.
No.
And a lot of other areas, you don't have the same requirements. So as a result, as you stated earlier, just because a child goes to a private school
don't mean nothing.
Right.
They can get miseducated right up in the $30,000, $40,000 private schools that the parents are forking out the money. And on top of that, some of these kids' parents are extremely wealthy, and they're going to pass their kids on. You understand what I'm saying? And they're going to graduate sometime in the top of their class, because money talk.
All right.
Okay? So some of these kids are getting education, and their parents done paid for that too.
Okay.
You understand? Okay. Now ask me, I know what I'm talking about. My kids went to private school. I know. So I'm just telling you, there is nothing better than a good public education. The parents, if you feel that you're inadequate and can't really help your kid, then there are people out there, there's organizations out there that will get your child and help you with your child in the educational process. There's a lot of them. I can think of a lot of different organizations and people, individuals. There's the Divine Nine. I mean, there's a fraternities and sororities that are doing great things in the area of education and helping young moms and dads with educating their kids and getting them prepared for college. So it's no really excuse. And we got uncles and aunties that have to step in and help these kids who come from dysfunctional families, because we deal with that as well. So we understand the social issues that affect our children and how some of them fall through the cracks. But there is help. And when you see a child struggle, I'm not going to call anybody's names out, but you all know she's a social media sensation locally here and is doing great things for young people, helping them get their college application, getting them what I call a free ride all the way to Harvard and Yale University. I mean, just doing powerful things. But the parents take the initiative, or an uncle or a grandmother or somebody in that family. When you know the parents can't do it, there's somebody in that family to get those kids and get them channeled in the right direction. Don't blame it on the state representative, because he's up there making policies and procedures for us to do better here at the local level. But you got to do your part. You have to do your part to get them there. And so that's what I want to say about that education. Now, the seniors, we're going to move on from education, because y'all, you know, you have the responsibility to make sure your kids get out of high school. If you can't help them, because maybe you didn't graduate from high school, this map is complicated now. And some of the requirements to graduate sometimes can be above your head. That's when you call on somebody to help you and get that help. That's what I'm going to challenge the parents to do. If you can't do it, as an uncle or auntie, you know this, your sisters and brothers' kids are falling behind, then make it your responsibility as a family member to get those kids where they need to go and to help them. Or if you can't help them directly, you know somebody that can.
Yes.
You know, go to your church pastor. Start there. You know, we were talking about that earlier. The church had a big role in Black families. And I like Black families. I don't say Black families because I don't know about the white church, but I know about the Black churches. They had a big role in getting those kids and making sure they didn't fall through the cracks. Everybody was family at the church. So there's ways you can help your children if you can't help them. Now the seniors, what are we doing about the seniors in this community? Because that's big. That's big. They want a place where they can go work out and a place where they can meet and gather. They don't have a place like that. So what are we going to do to make that happen?
What we find, first of all, is that city, county, and state governance, I'm going to use the term, we don't try to tell each other what to do. And so there are things that are expected of the city and the county to solve that problem.
At that level.
But then there may be a need for, we say, a new building or funding for, in some way, the persons who operate it, that the state could, participate in. The state would be a partner in something like that, but would not want to, be out front.
Overstepping the bounds.
Yes.
I got you. I got you. So now for the seniors who are out there listening, and I know there's some neighborhood organizations working real hard and getting some things, because I personally know one of them is a family member working really hard to get that facility and a place where the seniors can go and have a safe haven, I would call it, to work out. They used to have Eastgate, but that's no longer available to them. Working together with your state legislator, your mayors of your city, we can find a solution for these seniors.
I agree.
We can do that. That's a little problem. The seniors, that's a little problem.
And see, sometimes we overlook the power that a group has.
Oh, yes.
Now think about right now, who are the voters in particular?
Yes.
In our district and other districts around here, seniors.
Seniors.
They come up, not just Black folks or white folks, in a time where they realized and understood that voting makes a difference.
Yes.
So if everyone comes together and talk with their legislators, we're not talking about just our district, but the other districts in Hamilton County, then we can have a coalition that works with both city and county governments to get this done. And what we're saying is, your city elections, your county elections, and your state elections, someone advocating on your behalf to get something done. It can be done if we all, and a word you used a minute ago that I like to use a lot, working together works.
Working together works.
We can get something done.
Yes, we can. And I know about the power of collaboration.
Okay.
The power of collaboration, y'all, is amazing what will happen. Because you, as an individual, you may not have the power. But if you get with Representative Hakeem, who gets with Representative so-and-so, who gets with Representative so-and-so, who gets with Mayor so-and-so, who gets with Governor so-and-so, I myself cannot get to the governor. But through these different collaborative efforts, we can get to the governor and we can make it happen. We can make anything we want happen if we work together. Anything.
All right.
Anything. And you got to put God in there. Through God, with God, all things are possible. I believe that.
Yes,
and when you plug into that power, I'm sorry you're on my last segment, but when you plug into the power of God, ain't no electricity like the electricity that God has, and how he can move like a bolt of lightning in a situation and make things happen just like that. That's God. That's the power of God. He can. Did he end slavery?
All right.
Did he end it?
All right.
All right. Okay. So what I'm trying to say is, God is, at the end of the day, I don't care if you're a Republican or a Democrat or nothing in between, God is going to work it out when we pray.
All right.
When we pray and have the faith the size of a mustard seed. That's all I have. That's all I have. Is the faith the size of a mustard seed? But I know God and I know the power of God. So they say, how you doing all that? They want to know, how do you take a nonprofit organization like Alton Park Development Corporation with nobody giving you any money? How in the world did you make all of that happen? I said, we may not have any money, but I know a man. I know a man that's got all the money. So it don't matter. Don't make me your target. Right. Make God your target and see how far you go. Because God is running everything, not just in Chattanooga, not just at Alton Park Development Corporation, not just in the state of Tennessee, not in the whole United States. He's running everything in this world. He has the power to do whatever he wants to do. And he's going to let some things run its course because his word will not return void. So some of this stuff that you see going on is supposed to happen. And God's sitting up there. He's just looking down. Because he already know how it's going to end. He letting the devil have a little fun. It's okay. Let him have a little fun. Because he already know when he get ready to stop it, guess what? He going to stop it.
All right.
So don't worry about what's not happening right with the state representative. Get on your knees and start praying and collaborating and working together. Don't matter if you're Republican or Democrat, no matter whether you're Christian or not. You better start working together and collaborating. You can make everything you want come to fruition.
Yes.
It works. That's why I ain't mad at nobody.
All right.
I ain't mad at nobody. Because if you get mad at somebody, that's one of your collaborative partners that you may need to make something happen. So you ain't got time to waste being mad or angry at anybody. If they do something to you, just knock it off. Don't worry about it and keep on going. Keep your eye focused. The Lord said, his eye, keep your eye on what? It's on the sparrow. Keep your eye on the sparrow. Don't lose your focus because there's a lot of stuff going on that get you distracted. Your eye should remain on the sparrow. And then you should keep yourself focused in the word and understand what God has for you to do and do it no matter what somebody else says.
Okay.
Keep on moving. That's what I'm going to tell Representative Hakeem. Keep on moving. Okay. If the dogs come after you, they used to say that. And if you hear the dogs, keep on running.
Yes.
Keep on running. Don't look back.
All right.
Don't worry about it. Because if it's for you and you in God's will, guess what's going to happen?
All right.
You're going to win.
All right. Praise God.
You can't lose with the stuff he used.
All right.
You can't.
Amen, sister.
You can't lose. I'm telling you, y'all know this brings us to the conclusion of our story. But I'm going to let Representative Hakeem have the last part because there may be some stuff he really wants you to know. And I'm going to let him have that moment to do that before I do my closing remarks.
Well, firstly, I just say some may feel that I don't talk enough. What I try to do is get things done and not worry about taking credit for it. But the reality of politics is that you have to take credit for what you do. And that's why today we talked about some of the things that we've done in regards to appropriations. There are many other things. If you go to my website, that you can find out what we've done and what we are doing.
What is the website? Can we flash that on the screen? His website?
And now there's one area that, you might be able to put that on there.
Okay, go ahead and put it on there.
Okay. And so what we're trying to do, as I said, is to just get things done. And hopefully entities like Dr. Woods will afford the opportunity to bring forward those kinds of things. We are working in your behalf. We are building relationships within the legislature to get things done. And we'll ask you to continue to work with us to get these things done. Thank you.
All right. That's a good speech right there. I want to tell you all, you know how hard it is when you're standing by yourself, and that's how it kind of feels up there at the state when it's only 24 Democrats. If you're a Democrat.
Yes.
I tell people I'm bipolitical. I look at people's character. And Representative Hakeem has an excellent reputation and his character is impeccable. And I know that when you are by yourself, it seems like you can't get nothing done. But just understand that he has to work with everybody just to get a little piece of the pie. You see what I'm saying? And give him more time and opportunities to keep building the momentum.
Okay.
You know, don't do him like that. Give him the opportunity to continue to do great stuff. You know, and if I can overlook some stuff because I understand what he's going through. You gotta be there, have been there to understand that.
All right.
And I've been there, and I know that, and I understand that. I know. And so, because I know, I have so much patience and understanding and love for him, understanding what he's going through every day when he goes to work up there for us. You know, and people think they can do better. No, you can't. Not with 24 votes. Not with 24 votes. You can't. You got to wait on time.
All right.
Give time. Give Father time, his time.
All right.
Give it to him. And when the time is up, there'll be time for somebody else. But he just got there.
Okay.
He was a freshman. Now he's a sophomore. Oh, he's making stride now. This ain't the time.
Okay.
I'm probably going overboard what I'm supposed to say. I don't care, whatever. Take me off the air. But you have to give people time to build their momentum. And when they're getting good in there, they got all these friends they've made. Take a couple of years to make the friends. It ain't the time to change the dog in the race.
Okay.
It's not.
Okay.
It's not time yet, y'all. That's all I'm going to say about that. I ain't going to tell you who to vote for. You can vote for who you want to vote for. And I ain't going to tell you who I'm voting for because I'm on the radio. But I will say this. Use your vote wisely. Use it wisely. Wisely. Call them up. Talk to them. Talk to all the campaign people that's running. Talk to all of them that's got campaigns going on. And then make an educated choice when you go to the ballot and make your vote. Make sure you've got everything considered and make the right choice. Remember, it take a while to move from being a freshman to being that senior.
Okay.
Y'all remember that now. Now, today is Saturday. Y'all know tomorrow is Sunday. So that means that this is time for you to find a church home if you don't have one, to go and give the Lord praises and thank yous for all the great and wonderful things he's done in your life. He sure has done wonderful things for me in my life and continues to do wonderful things. I'm a walking miracle.
Okay.
And so on Sunday, it's just one day. You should be praising him every day of the week, 365 days out of the year. You should be praying without ceasing. That's what you should be doing. But on Sunday, where he says, you know, fail not to assemble yourself, you need to get together with some other saints or people that pray like you, whatever.
Okay.
And say, thank you, Lord. And give him, he loves to hear from us. Find your church home, even if it's at home. You know, on Sunday, turn on your TVs, or turn on your computers or whatever. Everybody's live streaming now. You can go to church right from your bed. I don't encourage that because God said, fail not to assemble yourself. But you can't get there for whatever reason. But you can still praise him. You can still give him praises for all the things he's done for you. And if you don't have a church home, you're always invited to Greater Emmanuel Apostolic Church, where Pastor Paul Warfield is the pastor at 400 Tunnel Boulevard. And I know that Hakeem, since he's sitting over here on my left, is a member of Second Baptist Church. And who's your pastor? I'm going to let you shout him out. Who's your pastor over there at Second Baptist?
Dr. Ernest L. Reed Jr.
You all know where he is, right next to Kentucky Fried Chicken on 3rd Street. You all go on and give them a visit. They get down over there. That's a beautiful church, a wonderful church. My church is a beautiful church. We just finished up Vacation Bible School. It was an amazing time for the kids and young folk. And so please, you know, and this is a radio station that we really aren't supposed to do Christian or Jews or, you know, whatever, Muslim, whatever. But we say, whoever you praise, whoever is your God, you know, mine is Jesus Christ, the Lord, that's my Savior. But give him thanks for all the great things that he has done for you in your life. and he'll continue to bless you and get you through storms, whatever that storm may be. He's going to get you through it. Lord, no, I've been through some storms, and I'm going to go through some more.
All right.
I'm waiting on the next one. It's so calm right now. I'm looking. I'm looking all around saying, when is it going to come? Because they're going to come.
All right. All right.
Storms are going to come. They telling me now I'm negative 10 minutes. That means I've been going 10 minutes past my time. So I'm going to say one last thing, two last things. June the 22nd is the day that Alton Park Development Corporation is celebrating our Juneteenth celebration and our grand opening of our new African American Education and Heritage Museum. And you'll be able to sign up for some African American classes with I will call him doctor now, because he got it going on 50 years. 50 years of teaching African history. Mr. Harold Bryson will be on site to sign you up for those courses. We're going to have lots of fun activities going on. We're going to have African drummers and dancers, and Howard High School Band is going to be here performing. And we're going to have the petting zoo here for the kids, jumping bounces, all that good stuff, and good food. You all come on out. Bring your tent and your chairs. We're going to have I call it our park. We have a park out there. They call it a playground. I call it a park. Bring your tents and chairs and tables or whatever you want to do, and let's have a real good Juneteenth celebration good time. That's on June the 22nd. It starts at 10 o'clock in the morning. If you don't get here at 10, you're going to miss the ribbon cutting, because we got to start on time. We got a bunch of dignitaries that's going to be there, and they've got 5 or 6 things they got to do that day. So I promised them I wasn't going to hold them long. So at 10 o'clock, we cutting the ribbon, whether you're there or not. And then after that, you can join in on the festivities afterwards. But at 10, we cutting that ribbon, and we're going to open up this museum for you all to do. The soft opening is what I call the soft opening, so you can see a little bit of what we got to offer. And it's looking beautiful. It's looking beautiful in there. So until next Saturday, you all be blessed. And don't forget, I love you. It ain't a darn thing you can do about it. Until next week.
All right.